Welcome to Introduction to Healthcare and Public Health in the U.S., Delivering Healthcare, Part 1. This is Lecture B. The component, Introduction to Healthcare and Public Health in the U.S., is a survey of how healthcare and public health are organized and how services are delivered in the U.S. It covers public policy, relevant organizations and their interrelationships, professional roles, legal and regulatory issues, and payment systems. It also addresses health reform initiatives in the U.S. The learning objectives for Delivering Healthcare Part 1 are to describe the organization of healthcare at the federal, state, and local levels. Describe the organization of the VA system and military health system. Describe the structure and function of hospital, clinical, and administrative units, and describe different types of long-term care facilities with an emphasis on their function. This lecture discusses the organization of government healthcare services. This first slide gives an overview of the Department of Veterans Affairs, which was established as an independent government agency in 1930. Given veterans' sacrifices on behalf of all Americans, the mission of the VA is to ensure that U.S. veterans and their families receive medical care, benefits, social support, and memorials to honor their service. It is estimated that over 21 million U.S. veterans are alive today, so it is not surprising that the VA is the largest integrated healthcare system in the U.S. Veterans include all individuals who have served in the Army, Navy, Air Force, Marines, or Coast Guard. Members of the Reserve or National Guard are also eligible. The spouses, children, and parents of a deceased veteran are also considered family members. This flowchart illustrates how the VA is structured. The Office of the Secretary at the top provides oversight. Several specialized offices are listed at the top left, with programs for small business, employment discrimination, women veterans, and minority veterans. Just above the bottom row are offices for information and technology, policy and planning, security and preparedness, human resources, government affairs, and legislative affairs. At the bottom of the flowchart are three other branches of the VA: the Veterans Health Administration, which manages healthcare services, the Veterans Benefits Administration, which provides financial assistance, and the National Cemetery Administration, which manages burials and memorials. These three organizations oversee facilities throughout the U.S. This lecture will focus on veterans' health and veterans' benefits. The VA has 5 strategic goals. The first is to empower veterans to improve their well-being. Another is to enhance and develop trusted partnerships with organizations that provide benefits, services, and resources to veterans through improved collaboration, business practices, and outreach. The VA honors veterans in life and also after death through burial and memorial benefits through the National Cemetery Administration. The VA also works toward national goals of public health, emergency readiness, and socioeconomic well-being. Finally, the VA strives to manage and improve VA operations to deliver seamless and integrated support to veterans. This table lists some of the services that the VA provides. Veterans are entitled to these benefits after discharge from active duty, assuming they were not dishonorably discharged. For convenience, these benefits are classified as medical care, mental health services, and logistical or financial support, as shown in the 3-column headings. Examples of medical care listed in the first column include outpatient health care at various types of facilities, hospitalization, and information about health issues. Preventive care, dental care, and nursing care are included as available medical care. Preventive care includes disease prevention, smoking cessation, and weight control. Women's health care and prescription refills are also available as part of medical care. Mental health services listed in the second column address problems of readjustment to civilian life, post-traumatic stress disorder, substance abuse, and suicide prevention. Veterans have access to a chaplain for their spiritual needs. Patient advocates are available at every VA medical center to answer questions or help veterans deal with any problems or special needs. Rehabilitation is available for psychological as well as physical trauma. Logistical and financial benefits, as indicated in the third column, include disability compensation, pensions, and the GI Bill, which provides financial aid for college education. Also available are vocational rehabilitation, assistance with employment, educational assistance for veterans' children, life insurance, traumatic injury insurance, home loans, and benefits for survivors of deceased veterans. In addition, assistance is provided for burials. The numbers on this slide speak to the size and importance of the VA system. Nationwide, it has 151 medical centers, 820 community-based outpatient clinics, 135 community living centers, 103 residential habilitation centers, 300 vet centers, and 139 integrated disability evaluation system sites. Some VA services are also provided in patient homes. There are some specific facilities that offer health-related services to veterans. The most obvious are VA hospitals. Many areas of the country have veterans' healthcare systems, which are groups of affiliated medical centers and clinics that share resources to provide comprehensive care more efficiently. Two examples are the VA Pittsburgh Healthcare System in Pennsylvania and the VA Puget Sound Healthcare System in Washington State. Community-based outpatient clinics are freestanding clinics that provide routine outpatient services such as health and wellness visits. They are located in every U.S. state, plus the District of Columbia, American Samoa, Guam, Puerto Rico, the Philippines, and the Virgin Islands. These clinics are intended to be convenient alternatives to traveling to a large medical center. Community living centers are nursing homes for veterans. Skilled nursing care is available for veterans with chronic conditions such as dementia, those who need rehabilitation services, and those nearing the end of life. The domiciliary care program is the oldest health component in the VA system. It was established after the Civil War in the late 1860s, when facilities called soldiers' homes began to provide care and housing for disabled and poor veterans. VA domiciliaries are residences that provide treatment and rehabilitation for veterans with severe medical conditions, mental illness, substance abuse disorders, or other psychosocial problems. The domiciliary care program operates together with the VA's mental health residential rehabilitation and treatment programs. These programs aim to foster healthy behaviors in a safe living environment, improve quality of life, and help veterans participate in their communities. Vet centers provide counseling for veterans who have served in a combat zone and for their family members who need assistance coping with military issues. All 50 states, including the District of Columbia and U.S. territories, have vet centers. Counseling services provide help with readjustment to civilian life, medical problems, sexual trauma related to military service, substance abuse, bereavement for families of deceased veterans, and other services. Healthcare services can also be provided to veterans in their own home. Skilled home care services involve short-term care that is delivered by a community-based home health agency that has a contract with the VA for veterans who are homebound or live in a remote location. Homemaker and home health aid services can be utilized to help veterans remain in their own home. Home telehealth allows the veteran's physician or nurse to monitor the veteran's health remotely using home monitoring equipment. One of the current concerns about U.S. healthcare is the fragmentation of services. To minimize this problem, the Veterans Health Administration is divided into 21 numbered units called Veterans Integrated Services Networks, or VISN. Each network coordinates and supervises administrative activities and the provision of healthcare in its region. This map of the U.S. shows the states and territories included in each of the 21 units. Unlike the VA, which serves veterans and their families after military discharge, the Military Health System, or MHS, covers active duty U.S. military personnel wherever they may be serving. The Military Health System is a global medical network operated by the Department of Defense. The Military Health System is made up of the Office of the Assistant Secretary of Defense for Health Affairs, the medical departments of each of the major military service branches, the combatant command surgeons, and the TRICARE providers, including those in the private sector. TRICARE is the managed health care program of the Department of Defense. TRICARE is a series of comprehensive, low-cost health plans operated through a network of civilian healthcare providers, such as physicians, hospitals, and pharmacies. TRICARE serves active duty service members, retirees, and their families from all 7 service branches, including the Army, Navy, Marines, Air Force, Coast Guard, Public Health Service, and the National Oceanic and Atmospheric Administration. Certain National Reserve and National Guard members are also eligible. Besides immediate family members, survivors, and certain former spouses may benefit from TRICARE. Service members may choose from 9 TRICARE plans. The most commonly selected plans are listed on this slide. TRICARE Prime is a health maintenance organization and the most affordable option. TRICARE Standard is the most flexible option. Retirees receiving Medicare benefits may enroll in TRICARE for Life as secondary health care coverage. TRICARE Reserve Select is available for a monthly premium to eligible National Guard and Reserve members. Other TRICARE plans are targeted at veterans who have been posted outside the U.S., and there is also a family plan as part of TRICARE Prime. Some of the plans require that the veteran assume some of the costs. This table shows some of the benefits offered through the TRICARE program. Many of the medical and mental health services closely resemble those offered for veterans through the VA system. Most logistical and financial benefits for active duty military personnel are available through the VA system rather than the Military Health System. TRICARE medical coverage in Column 1 includes outpatient healthcare visits, hospitalization, health information, preventive health care, dental and vision care, nursing care, pharmacy benefits, and services for female personnel such as maternity care. Programs for mental health in Column 2 include counseling, help in readjusting to civilian life, coping with trauma such as post-traumatic stress disorder and traumatic brain injury, substance abuse problems, and suicide prevention. Personal coaches are on hand to help coordinate medical care, and chaplains are available. Rehabilitation may be needed for physical and/or psychological trauma. Military conflicts arise all over the world, and the Department of Defense must be able to provide healthcare services wherever U.S. troops need to go. The Military Health Service provides all of the following types of care. First responder care is administered at the point of injury. Essential care is treatment to preserve life and limb, while definitive care stabilizes or rehabilitates soldiers at the location of conflict. Care is also provided during transfer to another medical facility, and logistical support optimizes the use of medical supplies, materials, and up-to-date equipment. The Military Health Service also provides education, training, and medical information technology services. Another function of the military health system is disaster response, aimed at protecting the general public, as well as members of the military. Such calamities might include mass casualty violence, emergency operations for homeland defense, flu outbreaks that require medications and vaccines, humanitarian assistance after natural disasters, and global health initiatives. The military health system is represented in the North Atlantic Treaty Organization, or NATO, and the International Committee of Military Medicine. To ensure excellent health care for active duty personnel, the military health system provides education, training, and resources for healthcare providers. The Walter Reed Army Medical Center and the National Naval Medical Center are two well-known hospitals that came together in September of 2011 to form Walter Reed National Military Medical Center. This large teaching and referral institution is affiliated with universities and treats wounded soldiers from the wars in Afghanistan and Iraq. The educational programs of the military health system include, among others, the Defense Medical Readiness Training Institute, which offers courses in trauma care, burn treatment, disaster preparedness, humanitarian assistance, and other types of military emergency response. The Joint Theater Trauma System, or JTTS, clinical practice guidelines are medical protocols developed by the Joint Theater Trauma System, part of the U.S. Army Institute of Surgical Research. Tactical Combat Casualty Care is a training course for medics, corpsmen, and other rescue personnel who are deployed in areas of combat. The military health system also supports and performs research at military treatment facilities and laboratories. Many projects are supported by federal funds from within the Department of Defense, but funding also comes from the VA and from the Department of Health and Human Services. One example of military research is the congressionally directed medical research programs, which study various diseases of concern to all Americans. The Military Infectious Diseases Research Program investigates vaccine and drug development. A final example is the Tri-Service Nursing Research Program, which supports military nursing research. This concludes Lecture B of Delivering Healthcare Part 1. In summary, the VA and the military health system provide healthcare and other benefits for those who serve the U.S. The VA is a federal department and serves veterans after their discharge from service. The military health system is operated by the Department of Defense, and it serves veterans during their military service. Both organizations offer benefits to all uniformed personnel and their families. The goals are to enhance physical and mental health, provide logistical or financial assistance, and thank veterans and active duty personnel for their service to the country.